All right. Welcome, everyone who's listening in. Um, Today, I'm going to talk a little bit about getting your testosterone checked. I've had a few clients some are going through this right now, and some are asking about it, and are also even asking about it for their spouses and that kind of thing. So, I'm going to talk about it for men, testosterone replacement, and checking your testosterone. Um, there's a lot of good information on this, by the way, for those of you that are not familiar with it. There's a YouTube channel called the TRT and Hormone Optimization Channel. They have a ton of videos, so it can feel a little bit overwhelming. What I recommend you do, anyone who wants to learn more on this topic and wants to go that route or go down that rabbit trail, really, check out their playlist. They have it's a Start Here playlist or something like that. It's very good content. Early on in my testosterone journey, that's where I learned a lot years ago. They don't make as much content as they used to. They still put out content, but there was, I think during COVID, they were putting out it felt like several videos a week, like almost every day. So there is a lot of good information on there, and I agree with most of it. Yeah, it's a good place to start. However, checking your testosterone. So who should check it? How do you check it? What does it mean when you check it? That kind of stuff. So I do want to preface this with saying that if you talk to your doctor about it, most primary care providers, they don't really know much about testosterone, including most urologists and most endocrinologists. You think endocrinologists would know everything about it because it's really not generally rocket science. And endocrinology is the study of hormones, but there you go, they don't. I've seen what endocrinologists and urologists have done to people, and it's atrocious. There's probably more primary care providers or non-specialist doctors who are competently handling people's testosterone than there are urologists and oh good grief, what was the other one? Endocrinologists, in my opinion, and from the people I've talked to. A couple of TRT specialists that I know of too would also attest to this. There's just a lot of dogma in those circles, and it's just wrong. It's based on very old information that was mostly politically motivated. So if you talk to your doctor and you tell him any of the things that I'm telling you now, they'll probably look at you like you're crazy. They'll probably disagree with you very strongly. That's their prerogative. And I can explain, I'll do my best to explain, but there's a lot of good evidence out there for everything I'm about to say. And both my personal experience and the experience of my clients, I believe, would also attest to this as well. So how do you check it? Well, let me step back. When should you check it? Really, the answer to that is whenever you want to. I think there's a lot more overthinking with TRT and stuff. Like, oh, guys are like, well, even your doctor's like, well, unless you really know you need it, don't check it because it's gonna just it'll cloud your judgment as far as whether or not you should use it or consider TRT. Well, that's fine. If you just want to know where it is, there's no harm in that. I wouldn't use labs as an end all be all to decide whether or not to pursue testosterone replacement. And the reason why is ultimately both treatment and diagnosis should go off of symptoms more than anything else. We don't just treat labs, we treat people. And so labs don't tell you what's going on entirely. There are some men I've talked to them that have actually had their testosterone checked, and it's very low, actually even as low as what my testosterone was before I got on testosterone replacement. And they feel great. They report that they feel fine. Like everything's fine. They have energy. They have their sex life is great. Everything's good. They feel mentally sharp. They don't have brain fog. They don't have any of the symptoms. And so they're like, well, I feel good. Why would I? And why would I bother? And I'm like, well, don't bother. Like, why would you take a medication that you already feel fine? So just remember that labs don't mean everything. However, you should get them done before, it should be a factor in making your decision, in my opinion. So usually what I would say is if you have the symptoms and the labs point to, yes, there's probably a deficiency here, then that's what you should pursue. If you have symptoms and the labs don't point to a deficiency, in my opinion, you should look elsewhere first, right? Because some of the symptoms of low testosterone could come from other things, including there's a lot of overlap with hypothyroidism. So if you have low thyroid function, it can cause very similar issues. And the other thing is you might not need testosterone replacement if you have a very, very poor lifestyle. It might mean making a couple tweaks can make a profound difference. I think it was Brett McKay who writes. It's probably not as popular as it used to be, but he writes for the he created the Art of Manliness blog. It's an older blog that started, man, over 15 years ago, or 10, 15 years ago, something like that. I think he's still active. He's just not as public facing as he used to be, in a certain sense. Anyway, he did an experiment many years ago where he had his testosterone checked, and he was generally living an unhealthy life. He wasn't lifting weights. He was eating a fairly poor diet, not horrible. He wasn't eating dessert all the time, but he was a little fluffy, and he just didn't feel good. He was going to bed late, sleeping in, circadian rhythm was all over the place, not getting any daylight exposure, just living like a typical American, basically. Not horrible. He wasn't abusing alcohol or substances or anything, but anyway, he had it checked, and it was low. I want to say it was in the 200s or something. And so he started doing CrossFit. He made some dietary changes. I think at the time he went like keto or something, which, as everyone knows, I don't really recommend. But that's what he did. But it's still better than a typical junk American diet. I've said that before, and I'll stand by it. And he started like going to bed at better times and getting outside more and some things like that. He had it checked again 3 months later, and it had over doubled. It was in the like 500 or 600s. So it was pretty good. I think at the time he was close to 30 years old or something. So pretty much an effect that you would expect. So if you have those low-hanging fruit items in your lifestyle, I would certainly say it's good to check and then change your lifestyle, see how you feel, and check again. And in his case, he felt a lot better, and the labs even looked decent. I mean, being in the 500 or 600s is usually good enough for most men to feel well. And so he decided it wasn't worth the trouble. Doesn't mean he won't ever do it, but in that case, he did. I think that was a generally wise decision. You might have other reasons for going on it because you just want better performance, not just in the gym, but maybe in your personal life. It can make you sharper and things like that. We'll go into it. But in his case, it wasn't needed. So what are the symptoms? Why should you check it? So you should check it if you have any of the following. If you have any kind of sexual dysfunction, whether that is erectile dysfunction, or that could also just be just like climaxing issues or things like that, just lackluster performance in general. If you have chronic brain fog or just anything like that, if you just kind of feel like you can also just kind of feel low, like low energy. It's very, very hard to be motivated. If you also notice that it's like, even from moderate training, you're just sore all the time. It's like you can never recover. That was one thing I dealt with big time right before I decided to move to testosterone replacement. It didn't matter if I was training light or heavy. I was always sore. That muscle soreness just never went away. It's like I could never recover. It's like I probably would have to like not train for 2 weeks for soreness to go away. Like I just didn't recover. I just would like go down to the hole, then I'd deload, then down to the hole, and then I'd deload. And it wasn't from really overtraining. I mean, it was overtraining for what I was capable of. But the workouts, even looking back now, were not bad. I wasn't training stupid. In fact, I had a great coach at the time too. He was doing a good job. The other thing is, if you notice, this is debatable, but so one of the symptoms that's officially listed is weight gain. Now, I think that's an indirect mechanism of action. Obviously, it affects your composition, but I don't think it's as profound as a lot of people like to think. I think it actually drives your behavior. So you become more active, therefore you're going to burn more calories, and so you're going to be less fat. Now, that's debatable. I get it. There is nutrient partitioning. It's very real when you go from low testosterone to healthy levels of testosterone. However, what I would say is that can explain some weight gain. But if a person is 100 pounds overweight, probably actually the way that it's going to help them more than anything else to lose weight is to increase it's hard to describe, but it basically would increase your willpower. And what I mean by that is they've actually done psychological studies to indicate that men with high testosterone levels, whether they're on testosterone replacement or they just have high levels naturally because they're healthy and et cetera, there's actually a reward that you get, a dopamine hit you get from challenge. And so the reward system for challenges and overcoming challenges becomes more profound. So that response that you get, that reward response for overcoming challenges in general increases, including just like getting through a workout, going for a walk when you know you should, getting up early, going to bed early. Like all of those discipline things, actually, they do become easier. And I can attest to that. as someone who went from very low testosterone to now very high testosterone, it is easier for me to have more willpower. I still pushed through things, and I wasn't an irresponsible person, but it's a lot easier for me to be sharp and on top of things and just push through challenges and difficulty with high levels of testosterone in general. So the weight gain thing, again, is the mechanism of action. I would just like to say it's not necessarily all just because of hormones directly. I think there's an indirect effect. So those would be the main things. Sometimes a reduction in body hair can be an indicator, or facial hair. Balding, I wouldn't go off of one way or the other. Guys with low testosterone can go bald. Guys with high testosterone can keep all their hair. It's super genetic. What I will say, though, is testosterone replacement, if you're prone to balding, will generally accelerate it. I had a lot more hair before testosterone replacement, but it was thinning out already. And I still, as the other men in my family that are all of us, all the Johnsons, I actually have the most hair, and I'm the one with the highest testosterone. So the genetic component is very significant. So if you decide that you want to check it, what do you do? Well, it's nice if you can just have your doctor do it if you have insurance, because it'll pay for it. Sometimes they won't do that. Sometimes a doctor will refuse, or sometimes insurance will make you pay some cash out of pocket. Usually, if you do this through your doctor, it's going to be far more expensive than if you just go online and order it through like Quest directly or ultralabtest.com. Those are usually going to be a lot lower cost. The times that I've seen people go through a doctor and then insurance doesn't cover it and then they have to pay cash, it's like triple the cost of what just going online and getting it would be. So that shows you what they're doing to insurance companies, and that's why insurance is so expensive. So that aside, just ask your doctor to check your testosterone. And what you want to do, and you might want to write these down, you want to have your total testosterone checked. You want to have your sexual hormone binding globulin checked, or SHBG is usually how it's going to appear on a lab. And you want your estradiol to be checked. And you want the estradiol test to be generally an ultra-sensitive estradiol test, because it's for men and it needs to be more sensitive, and because it's going to be in a lower range. Other than that, you just want to make sure that you have your normal your CBC, complete metabolic, or yes, CMC or whatever, complete metabolic panel, CMP, there we go. Complete metabolic panel, and your CBC, which is your complete blood counts. Otherwise, you shouldn't need much. The metabolic panel will include albumin, and albumin is part of the calculation for how much actual free testosterone you have. So the reason why you have your SHBG checked with that is it allows you to find out how much free testosterone you have. So most of the testosterone that you have in your blood, this is true of men and women. In fact, it's more true of women than men. Most of it is bound to SHBG, and some is bound to albumin. Those are amino acids or proteins that are in the blood. They bind to the hormone, and they basically extend its half-life. So when you make testosterone for men, it's usually in the morning. I believe an hour or two after waking is when it peaks. If it was the half-life would be very, very short. You'd be looking at, like, at the end of each day, you'd have like maybe a fraction of what you had before. But with SHBG, you can have higher and lower production days, and it sort of evens things out a little bit. Also means you don't get a huge spike in the morning that then dwindles. It means that you get what you get. A bunch of it is bound, and then it extends that life. So you get a more steady release. You need to know SHBG and albumin to make an accurate calculation. So what you want to do is just Google free testosterone calculator, and it should only require total testosterone, albumin, and SHBG, and it will give you what your actual free testosterone is. The reason I bring that up is because some men have a lot of total testosterone, but their SHBG is so high that it actually makes it so that the testosterone they are producing is basically not useful, and it's not doing them much good. And so basically they need TRT basically by merit of their SHBG is just so high. SHBG is just too high. And there's not really much you can do to lower it. It does go down, or it does go up rather, when you're dieting. Testosterone production tends to go down, SHBG goes up. So that's two factors that mean that your free testosterone will reduce. And other certain things can do that, including metabolic disease. So someone that's diabetic will often have that condition as well. Interestingly, women who have type 2 diabetes, they have PCOS often, which often results in high testosterone because of chronically elevated insulin levels. Men actually respond typically respond opposite. They actually will have reduced testosterone in the case of metabolic disease, and women will have increased testosterone in the case of metabolic disease. Not always, but that's how it often works. So if you check those, usually now the testosterone ranges will come back for the total will be like 300 to 900. 40 years ago, 30 years ago, that range was more like 500 to 1500. And if you had 500, your doctor would probably treat you if you wanted it. Now, if you feel fine, again, you feel fine. We treat people, not labs, but the ranges have been reducing a lot as the testosterone has been reducing in the male population in the West. So it's just gone down a lot. And it's due to environment, lifestyle, and a whole bunch of other factors. The other thing that'll be relevant, though, is obviously calculating that free testosterone. I don't have much of a target for where I think people's total testosterone should be. I've seen guys that just feel really good at like 700. And actually, if they go much past that, they get anxious and they feel tense. A lot of guys are just going to feel better on more, like almost like a more is better. And there's a certain degree to which you can begin challenging your health if you run it chronically high. So what I would usually say is you probably don't want to walk around above an average of like 1500. That's probably an upper limit, but that's even theoretical because we've had people that have walked around for higher than that for years and they seem fine. In fact, there are some men that naturally are documented to be higher than that, and they don't have like a bunch of cardiovascular disease or anything along those lines. I've heard of men testing in the 1700s. I heard about a man that tested at 1800 that saw a doctor that was in a group I was in. He tested, I believe, at 1800 nanograms per deciliter. And I think he was like 67. He was like in his late 60s. Just this guy's apparently a super stud, super healthy man. Just everything's good with him. He didn't have cardiovascular disease. He didn't have metabolic disease. So it seemed to work out fine for him. Now, what I would say, usually what you're going to do, though, is there's going to be a strong correlation between how you feel and what your free testosterone is. For most men that are natural and not on testosterone replacement, free testosterone above 15, they'll feel fine. It's in the teens and lower that they start feeling poorly. So when I got mine tested, I believe my free was like 7 or something along those lines. And then men, for some reason, if you're on testosterone replacement, it's kind of like you need more. Your lab values need to be higher to feel as good. And so usually we're looking at 30 or a little more. 30 or through the mid 30s is usually a good spot for a lot of men. Now, some men feel great on more. That's great for them. Some men actually feel fine at 25, but I'm just giving you averages. The other factor is your estradiol. So estradiol is worth checking before TRT just to know if high estrogen levels are suppressing your natural testosterone production. Because that actually has more of as much or more of a suppressive effect than testosterone itself. It might be that, so men get their estrogen and they need it from testosterone. It's converted. We don't really make it directly. We convert testosterone to estrogen in target tissues all over our body, mostly fat cells, which is why a person that has higher body fat will actually tend to have higher estrogen levels. They'll tend to have reduced testosterone levels because of it, because your brain looks at your estrogen and testosterone levels to decide how much to make. And an elevated estrogen alone can make you produce less testosterone. So if you come back and your lab values are like, say that your estradiol rather, is in the high 20s, let's say it's 28, and your testosterone is like 300, it might be just losing some body weight would take care of that. In my case, my estradiol was in the teens, I want to say, and I didn't have very high body fat at the time. I was probably, I had more body fat than I do now, but I was probably close to 16, 17%, I would guess. So if you decide you want to use it, go on testosterone replacement, your next steps would be probably to get it prescribed by a doctor. That's the official recommendation I would give. Although if you want to take care of it on your own, there are a lot of people doing so. And there's probably more now than ever because of how poorly treated men have been by doctors. So I'll leave that up to the individual. What is a red flag for me with a doctor is if they want to talk to you about keeping it under a certain range and that's like the end all be all. It has to stay under 1,000 or under 900. Last doctor I tried to see if they'd take over my testosterone was a doctor that totally fumbled my referral for my surgery and, gaslit me about a bunch of stuff, my lipids and my blood pressure. She told me that basically like, oh, you're probably going to die if you keep it over 900. And there's no clinical evidence for that, but that's what she said. So that's often going to be something you're going to hear is like, well, and so a good way to ask them about this is just say like, so what are you looking for when you treat a patient? Like, what are your targets? What do you evaluate? Leave it open-ended because they might say something about labs, they might say something about symptoms, they might say something about both, and just kind of listen. Are they just treating labs and just trying to get to a certain number? Because those are the kinds of doctors I've heard of doctors cutting people off. They won't even renew your prescription. For if you show up and you test at like 1100 or something, they'll like not renew your prescription as almost a way to like vindictively get back, and then they'll make you test again when you drop down to zero because your natural production's shut down. It won't come on for a while. It takes weeks or even months, and so then they just feel awful. And they get tested again and they like give them a hard time and then they let them have it again, let them have their testosterone again. It's horrible medical malpractice. The other thing that's a red flag is like when a doctor says to take an injection every other week, like the old school protocol of 100 milligrams every 2 weeks, usually going to wind up feeling far worse than before treatment. It's very rare that could ever be a material improvement for a man, unless he was like castrated or something, then it would probably be some degree of improvement. The other thing is like, if they just tell the guy, like, you're going to be on 100 milligrams a week, one shot, that's fine. You're never going to go above that. 100 milligrams is really low. Some men actually do great on that. They actually even have high lab values from it. But it's really rare that 100 milligrams is enough. Usually you're looking at between 140 all the way up to 300 milligrams to get a man to feel really good and also reduce risk factors while also not introducing new risks. So ask your doctor about those questions before treatment because you don't want to be left hanging or something like that. The other thing that I'll say is, of all the medications that I've heard of guys having a hard time getting at a pharmacy because it's out of stock, because it's considered lower priority to them, or because of shortages, this did happen during COVID, testosterone is one of the primaries. So I recommend that anyone who does this, very quickly, you have some degree of backstock. So you're not beholden to a pharmacy to have what you need to make you just not feel like a pile of crap, which you will feel like if your testosterone goes down to nothing. It's not the end of the world. You'll still survive and live. You'll be okay. But why have to do that when testosterone's pretty cheap? The probably the best way to treat your testosterone is generally going to be to go out of pocket. Very few doctors are going to prescribe it and get insurance to pay for it competently. Some do, some are good at it, but in general, you're going to have to go to a testosterone replacement office, doctor, or whatever, and you're going to have to pay cash. Usually there might be some out there that are still $100 a month, but usually looking at 100 to 200 a month, and that usually includes the medication. The testosterone is the cheapest part. Really, the most expensive part is you're paying for the doctor. They'll want you to do labs usually twice a year, which is great. But you'll usually pay out of pocket for those, but you might get your doctor to do it as well, and they might play ball as far as getting the labs that are necessary. Beyond that, what I would say is if you're looking for a nationwide online provider, there are a couple I could recommend, but they're the ones that are affiliated with the YouTube channel that I mentioned. That's Rejuvenate Men's Clinic, which is based out of New Jersey. I've heard pretty good things about Defy. I've heard okay things about Matrix. Defy is where I tell women to go because they're the only online nationwide provider I know of that seem to treat women fairly competently. The only other ones that I've ever heard of doing any good are local ones in certain places. For the most part, though, no local provider is going to have any clue what they're doing with hormone replacement for women. Certainly not men, but especially not women, because they're a lot more complicated, and a lot of doctors think that women just plain don't need testosterone, and they'll say all sorts of things to them that are completely untrue if you ask about it. So I hope that kind of gives everyone an idea. Other things I'd say to look out for would be don't ever inject testosterone subcutaneously into fat. The infection risk is higher. Usually get lumps, and it's rarely well absorbed. I've seen the lab work. Usually it cuts your testosterone that you're absorbing in half, and so you just won't get what you need. Again, a lot of guys get like sore lumps and things like that. Sounds nice. A lot of people talk about doing it online. You can sometimes get away with it if you're doing tiny portions like daily or every other day injections, which to me is just too much of a pain. You won't get the lumps, but you still won't get the absorption. I've gotten a bunch of guys to come off the sub-Q thing. I think it's kind of a fad, honestly. And their testosterone values have doubled after that. So I think that tells you pretty much all you need to know. So that's about it. If anyone has any questions that listens to this, just let me know, and I'll do my best to answer them.